The Honourable Minister of Health.
Thank you, Chair. Thank the member for that question. I think it's important for the member to be aware of, and I don't know if the members had the opportunity to do any reading or research into my comments yesterday on this very issue when she asked the question previously. Yes, our government was not only waiting to see the recommendations from the task force. In the meantime, we were also meeting with experts from across the country, experts here in Manitoba, and with our partners across the healthcare system to take steps to move this aspect of healthcare in a better direction. For 7.5 years, Manitobans, women specifically, had a PC government that cut many aspects of the essential healthcare they depend on, including the Mature Women's Centre, which was an innovative center of health excellence for mature women that provided care directly to those in a safe place in a manner that would support women in being able to have improved health outcomes, to ask questions about their breast health at older ages and stages of life, and perhaps mitigate negative outcomes that could have occurred because they had the opportunity to meet with experts who understand and are innovating women's health and mature women's health and that of gender diverse Manitobans. That's a good example of an aspect of healthcare cut by the previous government that actually speaks to the heart of this issue right now, the importance of investing in improving capacity around women's health in this province. And so for the past several months, we have been doing the work of righting the wrongs of the previous government who cut women's health care in a myriad of ways, rebuilding relationships with experts and partners across the healthcare system to ensure that we are investing in a healthcare system in this province that no longer disadvantages women or treats half the population as though their healthcare is not as much a priority as others. And so when we talk about breast health, when we talk about breast cancer, and we talk about mammography services, it is fundamentally important to talk about the comprehensive picture of what that healthcare needs to look like. And so our government has not only been awaiting the task force guidelines, of which there are many recommendations there that are important to look at, but we've also been working with our partners in order to invest in improving capacity around technologists in Manitoba. We've been working very closely with the Department of Advanced Education and Training and the minister responsible so that we can ensure that we are taking steps to train more folks in the area of allied health, specifically the technologists who provide mammography services, and developing ways that these folks can perhaps even get trained more quickly because, like other jurisdictions across the country, Manitoba has capacity challenges in this area of healthcare, something the previous government didn't bother to acknowledge or do any work whatsoever around to address. And so what we want to ensure is that we're listening to experts like the folks at Dense Breast Canada. Our office, my office rather, has met with these folks. We've met actually with Dr. Gordon, who the member mentioned, I believe, in question period to get her expertise. We've met with many folks across the healthcare system who have offered their advice and insights, including survivors of breast cancer. And so in all of the work and consultation that we've been doing in our investments to improve capacity in regions like the Prairie Mountain Health region, we are taking steps to make sure that women in this province and those who need this care can do so in a manner that is safe, is dignified, and comprehensive. And so I think it's important when the member asks that question for her to not minimize the realities that there are underserved demographics, there are folks who deserve access to this care, and we have to take a thoughtful approach to enhancing access to these services to not further disadvantage underrepresented groups who currently aren't getting this care and treatment in the ways that they should due to lack of information, education, awareness, or point of contact in order to do so. It requires a comprehensive approach. That is the approach our government is taking, and we are going to be taking steps to make sure that more women across this province get access to this care.
The honourable member for Roblin.
Thank you. Page 28 of the supplement references a multi-year phased strategy to enhance the accessibility and diversity of congregate settings with health services in Manitoba. I'm just wondering what this is a reference to, and if the minister can table a copy of this strategy.
The Honourable Minister of Health.
Thank you, Chair. I just want to continue putting some more words on the record, more information on the record in regards to my previous response. It's interesting to me, having worked on the front lines of healthcare as a nurse for many years, including during a time where we witnessed innovative centers of excellence for women's health be cut, closed, shuttered by the previous PC government, to see members of the PC caucus today not bring forward any sort of apology or acknowledgement to women across this province who are affected by those cuts and closures. No acknowledgement of what it means for 7.5 years to not invest in women's health care. Separate issue, we're talking about women's health, but I think about cuts that were made to lactation services, cuts that were made to, so many services that women and families depend on. And the place that we're in right now in Manitoba is interesting because what we're seeing in terms of some of the challenges that some folks have in accessing breast health related care is that underrepresented groups and lower income folks and others have increased challenges accessing this kind of health care. And for 7.5 years, the services that they would have benefited from in order to have the information, education, and awareness to access that health care was cut by the previous government. We in this province, shamefully, under the previous PC government, had ministers of health who wouldn't even talk about reproductive health care, who absconded that responsibility to other people in their cabinet because they didn't want to talk about abortion health care, they didn't want to talk about reproductive health care at all. They couldn't say the words breast health in the chamber. They couldn't talk about the very fundamental aspects of women's health, gender diverse health, that would have shown Manitobans they had a government that understood and valued their healthcare concerns. Now, Manitoba is in a place where we have challenges around capacity in order to adequately screen folks. Our government is taking action to address those capacity challenges. Now we are in a place in Manitoba where we're having to clean up the mess of finding innovative and creative ways to work with our partners across the province, work with targeted and marginalized demographics, work with grassroots organizations and service providers to ensure that those folks who have been denied access to essential services by way of a lack of any interest by the previous government to invest, that they have access to the information and services that they depend on. As our government does the work of expanding capacity and enhances the opportunity for women across this province of varying ages to access screening and treatment, et cetera, we must do and we are doing the work of investing in improving capacity. What we can't have happen, what we don't want to see happen, is what we've seen in other jurisdictions where demographics are expanded in terms of access to this care, and as a result, symptomatic women, older women, women at higher risk, lower socioeconomic demographics are unable to access this essential health care because there are challenges in being able to provide that care due to capacity not being addressed. And so I don't believe that the member is suggesting that we put those already in higher risk categories at greater risk. I don't think that's what that member is saying, but certainly I haven't heard that member state yet that she recognizes that the evidence and research that makes that very clear, that that is a consequence, unintended, of when things are rushed. It would be great to hear her put those words on the record. And so what I will say is that we are taking very real steps, and we are going to take very real steps to ensure that more women, varying demographics, are able to access this kind of screening and care. Especially, and this are in recommendations not just from the task force, but other entities as well, those women and folks who are at higher risk, who are symptomatic, making sure that as we expand access, which our government will be doing, that we're doing so in a way that ensures those who are higher risk, symptomatic, are able to access this care, and that those who aren't currently accessing care because the previous government didn't think about those folks, that they have the information, education, and awareness to know where to access these essential services and improve their health outcomes.
The honorable member for Roblin.
This has taken a disappointing turn. We have been in estimates for a couple of days now, and I felt that we've been fairly productive in here. I've asked questions, we've got answers, but now the minister wants to spend precious time in estimates making partisan political attacks rather than answering the questions. That's fine. I will continue to do my job, which is to try and get answers about this government's plans for healthcare in Manitoba. On the issue of breast cancer and this notion that expanding access to screening is going to disadvantage already disadvantaged groups, I think the minister knows that Black, Indigenous, and other people of color actually have a higher incidence of breast cancer at younger ages than other groups. And expanding access to screening for those groups is only going to help them. It's only going to save lives. And nobody has ever suggested that the minister needs to go out tomorrow afternoon and open the floodgates to women under the age of 50. Everyone gets a mammogram. Nobody is suggesting that. All we have asked for is a plan and a timeline to get Manitoba to a lower screening age, which would only bring us in line with every other province and territory in Canada. That is all I have asked for. But since the minister entirely ignored my other question, I will restate it. Page 28 of the supplement references a multi-year phased strategy to enhance the accessibility and diversity of congregate settings with health services in Manitoba. Can the minister tell us what that strategy is referring to, and can they table a copy of it today?
The honorable minister of health.
Thank you, Chair, and I thank the member for those comments, and I appreciate, I think that she did in fact hear what I was saying, or maybe she missed it, maybe, I'm not quite sure, but I do appreciate what the member just stated and put on the record in terms of higher risk demographics. I did state in my previous response that our government will be expanding and enhancing access, and that in doing so, we need to make sure that those folks who are underrepresented and at higher risk and higher risk categories are able to access this essential care. So I do appreciate that she put those specifics on the record. It affirms what I gave as a response in my previous answer. And I'm glad that we are in fact aligned in that our government's approach and the work that we're doing to ensure that those communities do in fact have improved access, which is actually aligned with some of the recommendations of the task force. They do recognize, as do many other advocacy organizations, not only here in Manitoba and across the country, but also in the United States, where there's an incredible amount of data on this particular issue, recognize that racialized populations getting screening earlier is to their benefit, and also recognize that racialized and underrepresented, targeted, marginalized communities have historically not had the access that they need due to the system not recognizing their unique needs and taking innovative, creative, and accommodating approaches to meet those communities where they're at. Our government does recognize the literature, the research, and the evidence on this. We've been actively building relationships with communities that have a hand-to-hand relationship with constituents that would otherwise not have access to care. And it's been wonderful, and I do want to shout out the organizations in our province who are doing incredible work. I think of organizations like CIRC. I think of organizations that are informal, folks in our communities who are champions for women's health care and who we are actively engaging with so that when we develop strategies to ensure that racialized and targeted and vulnerable communities have increased access by systemic design and policy under our government, that they actually have the information and the awareness to know where to go and how to access that care. And so I welcome those previous comments from the member because it speaks to what is at the heart of what our government is undertaking here. It's to make sure that we don't leave any Manitobans behind. And I do want to reiterate that those recommendations are reflected by the task force, and again, many other folks that when we've met with organizations like Dense Breast Canada and other organizations, they've been really clear about the importance of centering equity in this work. And I want to thank those organizations for having that really important lens on the work that they're doing. And so, this is an issue, a topic that is close to the heart of many Manitobans. Most of us probably have a loved one or friend or family member who's been affected by breast cancer, maybe survivors in our lives, or we've lost people to cancer, breast cancer specifically. I think of people that I know that I've lost. And so this is an area of healthcare that, again, touches all of us. We take it very seriously, with the utmost of seriousness, and also recognize that the approach that we take is not just about this particular area and building capacity in our province. It is about a comprehensive approach to women's healthcare and talking about women's healthcare in a manner that shows Manitobans that, yes, 50% of the population deserves to have a government that wants to champion that care and work with partners across the province in this area of healthcare. It is so crucial that government set the tone in terms of whose healthcare matters. Every single Manitoban in this province matters. The healthcare of every single Manitoban in this province matters. And the folks that I've had the pleasure of meeting with in terms of breast health in this province all have talked about gender diverse and trans Manitobans who also need access to this care, and how those folks often feel as though they don't have a place that's safe to go. They don't know how to have those conversations with their providers. It's important that those Manitobans know that they have a government that, when we talk about equity, we're also talking about gender diverse folks in this province. When I had the pleasure of meeting with many experts recently in terms of mature women's health, it was incredible to see that those folks as well, people who established the previous center that was cut by the previous government, also understand that, that aspect of equity. And so we'll keep working with partners to make sure that targeted vulnerable demographics have the care that they need, and we will enhance capacity for higher risk communities.
The Honourable Member for Roblin.
Okay, the minister has twice now refused to answer a question about long-term care and the government's multi-year phased strategy that's referenced in the supplement. So I'll move on from that, and I'll refer to page 29 of the supplement, which references a multi-year home care revitalization plan. I'm just wondering what this is in reference to, and if that document is public or if the minister can provide a copy.
The Honorable Minister of Health.
Thank you, Chair, and I thank the member for the question. And so, which is a very good question. It's a very good question, an important one as it pertains to seniors and those in our communities who are reliant on congregate settings. What I've also learned in this role was that some of those demographics are actually younger in age now and have certainly increasingly more complex comorbidity issues, things like that. And so having various settings where folks can live and reside and have the supports that they need is very, very important. We've known for a long time here in Manitoba, certainly across the country, about the increasingly aging population and what goes along with that. A good example would be Alzheimer's, dementia. You know, that's something that we know is increasing amongst senior demographics. It's also more prevalent now, it seems, in younger folks as well. And this is something that requires government to respond and plan, work with partners across the healthcare system and experts in developing strategies that are going to meet the needs of very diverse populations. I'm really happy to be able to say, especially I'm the MLA for Union Station, and Place of Pride is right in my neighborhood, right in my community. It's just down the street from here. It's pretty cool that Manitoba is a leader in the area of residential senior living for folks in the 2S LGBTQ plus community. I think that's really, really beautiful. It's the first seniors residence that is 2S LGBTQ plus specific in the country, right here in Manitoba, just down the street. Just across the street from the church that I was raised in, actually, which I just love. I just love Union Station and all the good things that are happening in it. But it speaks to the importance of having congregate settings, settings for the diversity of what our province looks like. And, you know, just because you age doesn't mean suddenly that aspects of who you are no longer just as important. It's crucial that we invest in working with partners and supporting folks across the province and having dignified places to live and build community at later stages in life. And so that's all the more reason why a lack of a provincial framework and strategy for congregate settings was concerning when we formed government, and recognizing that there was no plan under the previous government to invest or even really assess this area. That was concerning, especially given that we've known, like I said previously, for quite some time that our population is aging quite quickly. Our population is increasingly diverse, and that requires intention and a diverse approach to how we meet those needs. And so, yes, we are developing a strategy, a phased strategy that will support those folks who can no longer live in their own homes and who need community care supports. That is an approach that requires a provincial lens. I think that's really important to note. It's an approach that requires us to work with our partners to first get a full appreciation and understanding of what the landscape in Manitoba actually is. This is work that wasn't done previously, and it's really an essential first step, which is what we're doing right now, to understanding the landscape, understanding the needs of communities, and assessing what currently exists, where we need maybe more infrastructure, where we need greater supports, understanding, you know, what home care, as we stabilize home care across the province, as we invest in training more healthcare aides, for example. Are there areas and ways that we need to do this work that support congregate settings being enhanced and expanded in Manitoba to meet our increasingly diverse community needs? And so this work is underway, and again, we're having really important conversations and dialogue with experts in this area, with our partners across the healthcare system, with seniors themselves, which is really important, and with folks across the province who maybe aren't seniors but depend on congregate settings and count on congregate settings to meet their needs. This is work that's very important. It's also very important when you look at reducing pressures on emergency rooms and urgent cares and making sure that people have the supports they need in their own communities.
The Honorable Member for Roblin.
Thank you. I just want to clarify, because on page 28, it says a multi-year phase strategy has been formulated. And on page 29, in respect of a home care revitalization plan, it says it has been developed. The minister's saying today that they are in development. I'm just wondering, which is it?
The Honorable Minister of Health.
Thank you, Chair. Thank the member for seeking that clarification. I think I'm following what she's seeking clarification on, and I'll just stick to congregate settings. I believe that's the clarity that she's seeking. And so just to sort of better articulate what's on page 28 in the supplement there is a strategy that's been developed in terms of an approach to making sure that we understand what needs to happen for congregate settings in Manitoba. So acknowledging that this work has not been done previously, that there's a lack of data and information and a full appreciation for the landscape in terms of congregate settings in Manitoba. We're taking a phased approach, a step-by-step approach, in order to gather all of that information and have a true appreciation of the landscape in the province. That will allow us to, as we do this work, make targeted investments. It'll allow us to be nimble as well in terms of responding to the growing needs in this particular area. And so the multi-year phased strategy that's been formulated is an approach to ensure that we can gather all of the necessary information, that we can build the relationships with partners and leaders across the province in this area, that we can listen to and learn from Manitobans who depend on congregate settings and have needs in this area of our healthcare system. It allows for us to do an extensive analysis of the existing state of congregate settings in Manitoba, to look at other jurisdictions and see what we can learn from what their best practices are and what they're doing and how they're meeting their particular demographics needs. And following this comprehensive analysis, we'll be able to establish priorities, plans rather, and execute them that will support congregate settings in Manitoba. And so it's important, I recognize it's important for us to be flexible. You may start out with a particular objective in mind or a hope in mind, and then realize as you're getting information returned to you by experts and folks who are doing a lot of the heavy lifting here, that you've got to be able to pivot or adapt. And so as a government, we want to remain nimble in this area and really be able to listen to what communities, what regional health authorities, what congregate settings, directors, executive directors, residents are telling us. So we make very, very strategic and targeted investments to improve capacity in this particular area. It's something that takes time, something that takes dedicated work and effort, and that work has been ongoing and is happening quite literally as we speak. So I hope that provides a bit of clarity for the member on her question, and if she has a follow-up, I'd be happy to answer it.
The Honourable Member for Roblin.
Thank you for the answer to that question. I just want to go back to the topic of breast cancer screening for a moment, because I've been thinking about something the minister said, and it's not sitting right with me. The minister indicated that, based on something I said, that they thought we were aligned, and I don't think we are aligned, because Manitoba is now behind the rest of the country, and the Premier's answers in question period today indicated that the province is going to continue to follow the recommendations that were released by the task force this afternoon. Recommendations that experts from now across Canada are condemning for a variety of reasons. And I just want to read into the record some comments that were made by Dr. Jean Seeley, whose research I cited in the House yesterday during question period. And this is from a CP story, so it's public. Dr. Seeley said, "Failing to lower the age for routine screens puts racialized women at higher risk. The peak incidence of breast cancer for Black, Asian, Hispanic, and Indigenous women are all in their 40s, she said. By saying that they should not start until age 50 puts them all at a big disadvantage, and is one of the reasons why we see in Canada that they are more likely to be diagnosed at advanced stages of breast cancer." The president of the Black Physicians Association of Ontario also condemned the task force recommendations, agreeing that the onset of breast cancer is earlier for racialized women. Data shows that this group have a decreased mortality than other groups with early screening. This is attributed to the genetic variation that leads to a more aggressive cancer in Black women despite similar treatment. They have the most to benefit from early screening, end quote. Knowing all of this, And knowing that advocates are not asking for the minister to solve this problem tomorrow, is the minister prepared to commit today to lower the age of screening in Manitoba to better align with every other province in Canada?
The Honorable Minister of Health.
So the member would likely know that part of the reason why it's imperative that we ensure that currently underrepresented, underserved, targeted, racialized demographics of women who are not accessing this care are provided the information, awareness, and education and resources and appropriate services to do so is because they present later and are diagnosed at later stages of breast cancer because they haven't been able to access care. So it's with that in mind, knowing that there are already underrepresented targeted groups who are currently not accessing care because there are barriers, it's important to take that into consideration when we talk about enhancing access without having adequate capacity. Not only are those folks part of the demographics who aren't able to access care in a timely manner in cases now, I think the member understands, if she's read the evidence, has seen the impacts, the consequences in other places where there's a lot of evidence that reflects this, that it is those same demographics, yes, at younger ages, and including in the older ages, who will be further disadvantaged and at risk if you don't have the capacity to meet the needs of those enhanced parameters for screening. And so that's why I keep talking so much about investing in capacity. That's why we're working so closely with advanced education and training. That's why we're meeting with partners across the healthcare system and across the province to make sure that we are not only trying our best to better capture the needs of those demographics who are currently in the age range for screening and that care, who are not getting access, but to also ensure that we are doing our due diligence so that when we expand and enhance access for those who are in higher risk categories, yes, Black, Indigenous, racialized women, and those who need this care, that we have an approach that allows for them to be able to access that care. And, you know, the realities of a system that unfortunately still navigates very real systemic discrimination is that we must do our due diligence, we must be thoughtful, we must invest in not just improving capacity, but improving our understanding of how it is we ensure these folks get access to this care and information and education. And so I said it in my previous response in regards to this question. I was very clear that our government is taking steps, that our government is committed to enhancing access for more demographics and making sure that when we do so, we don't further disadvantage those who are already disadvantaged in accessing this care. And, you know, there are jurisdictions across the country that are facing similar challenges in terms of making sure that we have the adequate staffing resources, technologists being the big example that folks think of, making sure we have enough mammographers to perform this care in Manitoba. Manitoba, you know, we're going to be taking some unique approaches in terms of, and we are looking at currently through our retention and recruitment office and in partnership with advanced education and training, how do we make sure that we are encouraging and motivating folks to pursue a career path that would have them providing mammography care in Manitoba? And how do we do that in a way that ensures it is, again, bringing in those folks who currently do not have access and who are being diagnosed at later stages as a result and thereby have worse healthcare outcomes? It's so important that we recognize privilege in this conversation and that we talk about the realities of who has an easier time accessing care and who does not. And what we've learned from other jurisdictions, what we've learned from evidence and research has told us that we do have to make sure that those who are in higher risk categories have their needs met. Our government is committed to doing that work, and we're committed to doing that work in a way that doesn't leave people behind. It is talking about systemic discrimination, talking about who has privilege in the system, talking about equity. These are narratives that we didn't hear for 7.5 years, which is part of the reason why the lifting is so heavy right now, but it's heavy lifting that we're committed to doing alongside survivors, experts, organizations, service providers in this province. And I do look forward to being able to provide more updates in this area, including the update that we provided previously in terms of enhancing access to care in Prairie Mountain Health.
The Honourable Member for Roblin.
I acknowledge that lowering the screening age for breast cancer is going to require additional resources in the system. But I do not accept that keeping the screening age at 50 is going to benefit anybody, when if it creates an additional step for women who are unable to self-refer for a mammogram. Yes, racialized women in particular are dealing with more aggressive breast cancers at younger ages. They are dealing with systemic racism in the healthcare system, forcing them to first find and go to a family doctor to get a referral for a mammogram, rather than just allowing them to self-refer to Breast Check for a mammogram, doesn't make any sense to me. That's why the need for additional resources has been addressed by other provinces who have said, okay, this is a priority for our government. We're going to have this in place by this date. Saskatchewan says, I believe, January 2025. Ontario says fall of 2024. New Brunswick, I think, has said sometime in 2024. It's never immediate, There's an acknowledgement that there is a need to plan and put the resources in place to ensure that it's equitable for everybody. All we are asking is for the minister to make that plan and pick a date and commit to lowering the screening age for breast cancer in Manitoba so that Manitoba women have the same opportunity for early detection as every other province in Canada.
The Honourable Minister of Health.
Thank you, Chair, and I thank the member for that those comments and questions. I've been very clear that our government is working aggressively. We've done more work in advancing this area of healthcare and working with partners in the past 7 months than were done in the previous 7.5 years. And we are going to ensure that more demographics, especially of those in higher risk categories, Indigenous, Black, and racialized women, are able to access screening and treatment and care, recognizing that they have health outcomes that reflect a change in approach is needed. Our government's doing that work, and we're going to be able to share much more news on that in the coming weeks and months. And I want to reassure Manitobans that our government is listening to not only the experts, but we're listening to women and those who need this care, and experts and partners across the province. And we're going to continue to move this area of healthcare in Manitoba in a progressive and enhanced direction. Just want to read into the record something I took under advisement for the member, I believe last week or earlier this week, the vacancy nursing rates, regional health authorities. So Shared Health, 16.20%, WRHA, 15.6%, Interlake Eastern Regional Health Authority, 22.5%, Northern Regional Health Authority, 29.8%, Prairie Mountain Health, 28.2%, Southern Health, Santé Sud, 28%. Those are the stats for the vacancy rates for nursing combined rate of 20%. And again, I want to make very clear for the record that we are listening to Manitobans, we are listening to women, we respect and believe in investing in women's health. That is a necessary approach from government, any responsible government, and we are going to make sure that breast cancer screening, mammography services are enhanced in Manitoba, and that increased and enhanced demographics have access to this care, especially folks in higher risk categories who require a more flexible approach. We will be ensuring that there is a more flexible, accessible approach that recognizes the diverse and dynamic needs of women and those who need this care across the province. And I want to reassure folks that, whereas the previous government cut women's health care, closed women's access to healthcare services, our government is investing in strengthening it and working with experts and community members and leaders across the province who recognize that half of the population deserves a government that
Order.
supports their care.
Hour being 5 o'clock, committee rise.
Thank you so much.